Warm welcome to you. In just over 2 minutes, we'll be starting this live stream about singular insights by and for the people who make global health. We're actually talking about TGLF's, so the Geneva Learning Foundation's Insights unit. You can learn more about it at learning.foundation/insights. We'll be starting, as you can see, in 1 minute and 50 seconds. I'll see you then. And if you're joining our podcast, you might want to fast forward by just that long, because we'll be doing the countdown for our live audience. And so you may want to skip the music. See you soon. Thank you for joining. We are starting in 40 seconds. We'll be sharing Insights Live. That is when we share back some of the analysis, what we're learning from what you're sharing with us through the Geneva Learning Foundation's immunization platform. See you then. Welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and here, of course, with Charlotte Mbou, also from the Foundation. Charlotte, how is your afternoon going in Eboloa, Cameroon?
Everything is going just great, Reda, and I'm really excited to be here today. And I want to say a warm welcome to all those who are following us right here in the Zoom studio, but also across our various social media platforms.
All right, we're talking today about the future of immunization. So this is what's called Immunization Agenda 2030, the world strategy to achieve the immunization goals of having every child who needs to be protected from vaccine-preventable diseases, as well as families protected as well. We have already a lot of people who are joining across our different social media platforms, so I want to give them a round of applause before we go any further. Let's go. So Dr. Taimur Kayani from Pakistan, a warm welcome to you. Mecha Kingsley Ukpai, who says, hi Reda, please tell us, Kingsley, where you're connecting from. Yes, from Nigeria, but where it is a magnificent and massive country. And then Shahid Iqbal says, how are you? And also sends greetings from Pakistan. The same with Pakistan. We need to know where you're actually connecting from before we go any further. Now, for those of you who have connection difficulties, if you have poor connectivity, I really strongly encourage you to subscribe to our podcast. So let me show you how that works. Let me just get rid of the countdown timer. We no longer need that. So here you'll go to learning.foundation/podcast, type in your name here and your email here. And then you can listen on Google Podcast is the easiest. So very easy. Just click on the link. And you can see all of our live stream content is available here in a very convenient format. It's audio only, so if you struggle with connectivity, this can be a good solution. Now, if you're joining us for the first time, I want to warmly welcome you. You've just joined the world's largest platform of immunization professionals from Africa and Asia. And today, the number is 42,974. That's the number of people who are connecting through our platform. Now, it is not only about the connections we make at the Geneva Learning Foundation with you, it is also about the connections you make with each other. And you can see here a social network analysis of what kinds of connections you're making. Now, This week is a very important one. I'm going to share the link first and then tell you what it's about. So this is learning.foundation/immunization-agenda-2030. You can rewind the video if you didn't catch that. And what it's about, I'm going to show you right away, is the Movement for Immunization Agenda 2030. Charlotte is going to tell you in 2 sentences, no more, no less, what is the Movement for Immunization Agenda 2030?
It's the gathering of immunization professionals, those that are involved in primary healthcare from all over the world, because in 2020, global immunization moved backwards 20 years. So we lost 20 years of hard work. So it is a gathering of those who are making the difference in the communities, who are reaching those who need vaccines with the much needed vaccines that are coming together around the world strategy for immunization in this decade. That's Immunization Agenda 2030. And there are 3 very important reasons why you have to join this movement. Number 1, you need to share your experiences. You'll be joining to share experiences with colleagues from all over the world. And then, of course, you'll be receiving help based on their experiences on how you can solve your toughest challenge. And last but not the least, you'll get fresh ideas to help you to succeed.
All right, Charlotte. That's a little bit more than 2 sentences, I think, but we get the point. And here you have a page on the Learning.Foundation website where you can find the detailed information, including what Charlotte was sharing, the 3 top reasons to join this movement for Immunization Agenda 2030. And I just want to draw your attention to this quote: "Action without thought is empty, and thought without action is blind." This is actually a quote for the Ghanaians in the audience from Kwame Nkrumah, Pan-African leader and leader of the great country of Ghana. There are other quotes that you will find that refer back to the African experience. To get down to the point, we have here the activities in the first full learning cycle for Immunization Agenda 2030. So it's really an opportunity for every immunization professional to improve. And we know you're short on time, so it's about giving and receiving support. There's nothing we ask you to do that is for its own sake. Everything is about helping you do better in your daily work. So you can, of course, apply on the Geneva Learning Foundation's website. You have right now 4 days, 6 hours, 39 minutes and 38 seconds left to do it, to join. I'm going to turn to Emanuela Chinonye. Now, Nigeria is well represented. It is a country with the greatest number of participants so far. And Emanuela, are you able to speak to us? I'm asking you to unmute. I'm also going to ask Halima Toro to do the same, as well as Safa Trebelsi. Whoever will unmute first. You're with me in the Zoom, and Charlotte in the Zoom studio. So we definitely want to hear your voices. And you should be able to unmute yourself. We're asking you to unmute right now. Let's go to Samuel Shaibu. This is, of course, everything in the... all right, Samuel, good to hear your voice.
Hello, it's been a while, Charlotte. Halima, everyone, good evening.
All right, please do introduce yourself. Tell us who you are, what you do, and what are your thoughts as we're going into 2 big events, Teach to Reach on Friday, and then on Monday, the launch of probably the most important single initiative we've ever done, and that's to contribute to the Movement for Immunization Agenda 2030. But first, Samuel, tell us about yourself. Who are you? What do you do?
Dr. Samuel Shaibu. I'm a consultant with the Global Polio Eradication Initiative in Liberia. I'm responsible for the NOPV introduction and also post-introduction surveillance of polio and other VP in Liberia. An alumni of the program. What else do I have to say again?
Well, just what are your thoughts as we count down to Teach to Reach this time, and we're about to launch the Movement for Immunization Agenda 2030?
Oh, okay, sir. I'm actually an alumni and accomplice for the Agenda 2030 program.
Yes, indeed. Yes. So you are, and you've taken the WHO course on the Immunization Agenda 2030. Is that correct?
Yes, sir. I'm part of the first cohort.
All right, wonderful. Thank you so much, Samuel. We'll come back to you and to others who are with us in the Zoom studio as we progress, because actually we're here to talk today about Teach to Reach Connect 5. So what is that exactly? And this is a unique quarterly event. We do it every 3 months to meet, network, and learn with fellow immunization professionals from all over the world. Again, you just go to the learning.foundation website, find the page, click on request your invitation. It is happening this Friday. Now, here is the amazing story that I'm eager to share with you. We're going to be looking at what we learned from Teach to Reach Connect 4. It is a new learning methodology. That's what we do at the Geneva Learning Foundation. Our mission is innovation in how we learn, how we lead. And so Teach to Reach Connect is new. So you may ask, so what? What difference does it make? So we're going to tell you today by showing some of a few things that people said they learned by participating in Connect. And there were 6,163 people who participated. That's already fairly amazing. What is even more amazing, and what really impressed me this morning when I looked up the numbers, is this. As of this morning, we had 8,584 people, immunization professionals from all over the world, who have registered to join Teach to Reach on Friday, the 4th of March, 2022. Just absolutely amazing to see this many professionals committed to learning from each other. I'm going to greet a few more of them today. So we have who've joined the live stream. So we have, let me see, Wai Lin Ong from Lashio, Myanmar. So thank you, Kingsley, for clarifying you're connecting from Abuja. Dr. Mohammed Taimur is a national consultant for COVID-19 vaccination in Gilgit-Baltistan, WHO, Pakistan. And then we have Theophilus Kofi Tatsu, Tsikata Woyome. I hope I have gotten the pronunciation of your name at least partially correct. And you're connecting from Ghana, Theophilus. Great to hear you. We were just citing the great Kwame Nkrumah a little while ago. The call is very explicit. It is the saying that you may be familiar with: action without thought is empty. Thought without action is blind. So we're going to be sharing today the lessons from Teach to Reach. But before we do that, I know that Charlotte, or perhaps Halima, or perhaps Emanuela, has a very important announcement to make. One more reason, probably the best reason, to join us on Friday for Teach to Reach 5. Charlotte, over to you. What is happening? What is this Women Who Deliver Vaccines about?
Thank you very much, Reda. And yes, I'm really excited about this because for the very first time in Teach to Reach Connect, we are going to have a plenary that is for women who deliver vaccines. And this is an initiative of 143 women from 38 countries, sisters in arms when it comes to immunization, that came together to honor and celebrate women that work at the front line. They are from all levels of the health system, starting from the health facilities to the global level, but they have stories to share, experiences of how they are doing, what they are doing on the field to ensure that the populations receive the vaccines that they need and all the primary health care that is given to them. So if get a gist, visit the page on learning.foundation/IWD to see some of the interesting comments that came from the organizing committee members. But join us on Friday, whether you're a man or a woman, everybody that's in immunization. I said earlier, brothers and sisters who deliver vaccines, join us all on Friday, 4th of March, for this event to hear more stories and experiences from women on the front line. Thank you, Reda.
All right, wonderful. So we want men and women to be here. Let's go to Dr. Baba M. Sakwa. Let me see, he's actually got his webcam on. Let's see if we can get him on as well. Baba M. Sakwa, good to see you. Are you able to speak to us? We would love to hear from you. Hello, Baba M. Sakwa.
Yes, good evening, everyone. Hello, Rida and everyone.
Wonderful to see you. Tell us where you're connecting from, who you are, what you do, and what your thoughts are as we're counting down to Teach to Reach and to the movement for Immunization Agenda 2030.
Yes, I'm Mohammed Umar Sakwa. That's the real name. I am a routine immunization specialist. I work with the maternal and child survival program. I'm from Bauchi, Nigeria. Thank you.
Thank you, Mohammed and Sakwa. Will you be there to show your support and solidarity with women who deliver vaccines when they convene on Friday and are calling on men and women to express their solidarity?
Yes, really, as a mentor who mentored a lot of women in routine immunization, I'm excited to be part of the program on Friday, inshallah. And I will be the person to connect to the program. Thank you.
All right. And have you spoken to your male and female colleagues, so men and women, about Friday's event?
Yes, I shared the link with a group of more than 200 people, an individual of about 100.
Was there a response? Did anybody say, no, we're not interested, this is not any good, what's this about? How will this help me put food on the table? What was the response that you received?
Well, most of the response are willing to participate in the meeting, very much willing. Most of the response, especially the women folk.
All right. Thank you, Mohammed Sakwa. Thank you from Bauchi, Nigeria. We also have, all right, let's, so this is Women Who Deliver Vaccines. It's part of Teach to Reach on Friday. And now I also see William on the webcam. So let's see if we can bring you up and hear from you. All right. Welcome. I only see your first name, but please introduce yourself. Tell us who you are, where you work, and then tell me what do you think of all this? How are you involved? What are your expectations?
Yes, I am Wei Ling Ao. You can call me William because when you pronounce my name quickly, Wei Ling Ao, it sounds like William. So you can call me William. Right. Yeah, I'm from Myanmar. Can you hear me?
Yes, loud and clear. Yes.
Okay, I'm from Myanmar. I think, between India and China, our country is located between them. And then, I joined this event because it's very interesting. And in our country, in immunization, it is very challenging in our country because, because of political instability and COVID-19, because of two factors, the immunization status was very low. And then to rebuild the system is very challenging for all of us who are working in immunization. So I really want to share the challenges we are facing, and I would like to find the solutions together by getting the ideas from the colleagues who are joining here. Yes, I expect that.
All right, thank you very much indeed, William from Myanmar. And as you can see, this truly is an international meeting with individuals joining from all over the world. Now, today we've got a second plenary to announce for Teach to Reach. And that is the one on motivation. The question we're going to be asking is the following. And this is Sharath Jeevan. He's a global expert on motivation and intrinsic motivation specifically. He was with us for a live stream. You can go ahead and watch it on our YouTube channel. But your story is going to be at the heart of this session. So William or Mohammed Sakwa or Safa Trebelsi or Samuel Shaibu, how, in the face of so many challenges in immunization right now with the COVID-19 pandemic, how do you get up in the morning and actually get your work done, no matter what the challenges are, and how you tackle these challenges every time? That's what we're going to be asking you. And that's what we're going to be discussing and sharing experience about, hopefully so that we can learn from each other on what keeps us going to keep immunization going. So that's what we'll be doing in the second plenary following the International Women's Day event. Will be this unique session on the ultimate motivation challenge. But the reason we are gathered here today is to share the insights from the previous Teach to Reach. So on the 10th of December, we had 6,163 immunization professionals from all over the world who came together with a shared purpose of sharing experience in order to improve their work in immunization. One participant summed it up, and you can see the quote here: peer learning is the key to success, and networking is the key to peer learning. So we have here some of the, a little bit about the methodology. So our insights unit, and Charlotte and Boo is an important part of our insights unit, went through the more than 1,600 pieces of feedback that you shared. So 1,600 participants actually took the time to share quite detailed feedback. You can see the methodology here, and she has handpicked some of the most interesting excerpts. There's a slide deck of over 100 slides that summarizes the key learnings from Teach to Reach 4. This is in December. The next one is coming up on this Friday. And this slide deck has already been shared with all Teach to Reach participants. If you missed it, go and find it. It's in the Telegram channel. And what we want to do today is just share a few examples of what we learned through this kind of process. So we had a networking session where we explored immunization and primary healthcare as we catch up on routine immunization. We're going to dive right in. This is a first testimonial. Charlotte, over to you.
Okay, right. This testimonial came from a subnational Ministry of Health staff in Sudan, and he said, I learned that comprehensive immunization is the only way to achieve the goal, health for all. My commitment towards immunization had increased in spite of the heart conditions. I had the same thinking, but with less motivation. Now it is different. I would like to change the mindset of subnational fellows towards immunization for the better. Thank you, Rena.
All right, that kind of insight is gold. You could put this person who's a subnational staff in Sudan through many training programs and not achieve necessarily this type of outcome, or be, this is something that comes from the sharing of experience, from peer learning. There may be other ways to improve motivation. There may be other ways to help people realize that comprehensive immunization is one way to achieve the overall goal of health for all. I'd like to ask perhaps Safa Trebelsi. Let me see if she is now able to answer. Safa, are you there? Are you able to unmute? You've joined us in our Zoom studio, so we would love to hear from you. And all right, looks like Safa is not able to speak to us right now. So let's go to the second testimonial that Charlotte has selected. This one is coming from someone who works in national EPI, so the expanded program for immunization at the Ministry of Health in the country of the Gambia.
Okay, I learned about the concept of catch-up immunization and how to reach a targeted population to fully immunize our children. It also enabled me to know how to reduce defaulters by advocating for working parents to bring their children for vaccination even during weekends.
Wonderful. All right, let me see if we can go now to William. So William, you are not in the Gambia. You are in Myanmar. When you see this kind of insight, perhaps this is something that for you goes without saying, that you're sort of helping accommodate the schedules of working parents is a good way to improve the chance that they will be able to vaccinate their children. What for you is the significance of such an insight? When you hear that a colleague from the Gambia learned this during Teach to Reach, what are your thoughts?
Yes, this might be a common challenge for all of other one maybe in our country. We have also such a kind of similar challenge for the defaulter. For example, for the lower income family, when a child was vaccinated, they got like a kind of AFI for a mild fever or something like that. When they got the fever, the mother cannot work or earn money because she has to take care of the kids all day long because the kid had a fever. So for such a kind of situation, most of the women don't want to go for vaccination because they know that after vaccination, their children might got the fever or some kind of AFI or something like that. So we have to advocate among the children, among the women to get the vaccination to overcome that kind of situation. I just had my fever after after the vaccination is nothing compared to the diseases who were acquired when they didn't get the vaccination or something like that. We have to advocate like that according to the situations or according to the places where we do advocacy. So that's the main problem for the women who have to work for their income. Yes, that's my opinion.
Thank you for sharing. All right, let's, so in networking session 2, we are going through a few of the key learnings that we found when we reviewed the Insights unit. Charlotte and Boo reviewed more than 1,600 testimonials. Sharing of experience from participants in the last Teach to Reach that had over 6,100 participants. On Friday, 4th of March, we're going to go to the next one. You can join to benefit from meeting, networking, and learning with fellow immunization professionals from all over the world. You can see where our network currently is reaching over 40,000 people from 120 countries. You can be one of them and contribute and benefit. Just go to the learning.foundation website. Now, there were 3 networking sessions at the last Teach to Reach 4, and we're looking at the insights we gained from it. Immunization and primary healthcare during the rollout of COVID vaccines. So adding to the burden of already, in many countries, in many places, overburdened immunization staff, the question we asked was, can we do it all? And there's quite a long quote here that Charlotte has selected. I'm betting that it is worth reading from beginning to end in order to see what this WHO country office staff person from Sierra Leone, working at the national level, so supporting the country's Ministry of Health in planning its immunization strategy, supporting implementation, had to say about what they learned on the relationship between the effects of COVID-19 vaccination on immunization and PHC. Charlotte, over to you.
Definitely, Reda. COVID-19 outbreak has affected the health sector in many ways, including immunization. High hesitancy is observed in the country following myths about vaccine safety. There is pressure on the health system with limited staff having to battle with disease outbreak response. COVID-19 vaccine rollout did not only reduce staff manpower for primary health care, but also affected patients and clients' utilization of services. Having a session to discuss country experiences in terms of challenges and measures put in place to mitigate the effects of COVID-19 on primary health care was well thought. No individual country has all the knowledge on how to address the gaps.
And Charlotte, you selected this quote and highlighted this part of it. What to you is significant here? Why is this a useful insight?
Well, to me, rather, I found it useful because we are a global community, if I can put it that way. Today we have Mohamed Umar Sakwa from Nigeria. We have William from Myanmar. We have other colleagues from the Gambia, from Ghana, everywhere coming together. And it is bringing experiences of primary healthcare from all these different contexts that will help to build maybe a picture that can provide solutions, sustainable responses to the challenges that are faced by one. So when I saw how this national level staff from Sierra Leone could say that the challenges that we are facing, other countries are facing it, but it is only by putting, it's like a jigsaw puzzle, putting the different pieces from different countries together to have a complete picture and a complete solution that will help to solve the problems or the challenges that are faced in primary healthcare associated with COVID-19 vaccination. Thank you, Rena.
Indeed, and here we have another quote from Liberia. So this is a subnational staff, also someone who works for the WHO country office, who says, what I found most interesting, so this is from participating in a session at Teach to Reach 4 on asking the question, can we do it all? So this was networking. This was not listening to people's presentations. This was meeting colleagues from all over the world and saying, how is it going for you? Immunization and PHC during rollout of COVID vaccine. And this person says, what I found most interesting was the fact that most countries faced the same kind of challenge during the introduction of COVID-19 vaccines, where there was early rejection. This made me feel that adults are more concerned what they take in, so what they put in their bodies than what they would accept for their children. So I'd like to ask if there's anyone in our Zoom studio who'd like to respond to that. It is true that there's sort of decades of work to explain to parents the benefits of vaccination for children, and here we have all of a sudden a vaccine for adults. Let's see if Akosua Giima Omari Sasu. Let me see if Akosua is able to speak to us. Akosua, I'm asking you to unmute. We'd love to hear from you on this topic, but first, please do introduce yourself. Tell us who you are and what you do.
My name is Akosua Giima Omari Sasu from Ghana. I'm a Metropolitan Health Director for Kumasi Metro.
All right.
So I'm a health director.
Thank you very much for joining us. Thank you very much indeed. When you hear this person, this colleague from Liberia saying that he or she feels that adults are more concerned about what they put in their bodies than what they accept for their children, what are your thoughts? If you had someone in your team, someone in your staff working at the subnational level coming to you with this concern, what would be your response? What would you say to them?
I would take them through the importance of vaccines so that we all understand that vaccines, they are vaccine preventable diseases, that we are protecting children. And we also take children as people for the state. It's not just for the parents who brought them. So the adults, all of us are supposed to protect them in terms of public health, and we know vaccines work. So we try and educate the community so that they understand that it's not only adults that needs to be concerned about things that go into their body, more especially all of us collectively should be concerned about children and how these vaccine preventable diseases, we can protect children from them.
So let me ask you this, in Ghana, where would you say, what are your current challenges? What's your biggest challenge, your most important and toughest challenge that you're facing? I ask this, of course, because globally, we face a situation where global immunization coverage levels for infants have dropped back to 2009 levels. It's like the world just lost 11 years of hard work in favor of protecting children and adults from vaccine-preventable diseases. As a health director in the Ghana Health Service, I presume, what are your thoughts? How do you engage with your staff around the challenges that you're facing today?
So what we are doing, initially when the pandemic was high on, attention was on COVID. And when vaccines became available, attention was drawn on how to get masses to come for the vaccination. So the routine immunization and the outreaches initially went down because all the staff were concentrating on getting people to take their COVID vaccination. Now things have stabilized, so we are making sure that routine immunization services are still ongoing. Outreaches are being organized so that we don't miss out on these children and the gains we have made over the years. So we are ensuring that routine immunization services are still continuing in the midst of COVID now, as we speak.
So let me ask you, of these challenges, children unvaccinated and missed communities, epidemic outbreaks of measles, yellow fever, and other diseases, lack of confidence in vaccines by the community, marginalized community that is hard to reach, gender barriers to immunization. Which one of these would you say is your top priority right now?
It's difficult to pick one.
Yes.
We are making sure that routinization services are continuing, and the pockets of those who are hesitant for COVID vaccination, we're also tackling that. So we are ensuring that, making sure all our missed children, we get them vaccinated. These are where our attention are on now.
So Kate, Dr. Kate O'Brien, she's the Director of Immunization working at the World Health Organization in Geneva. And one of the things she told us is she feels that people, so immunization staff at the local levels, should feel like they have the authority and are empowered to lead change in their community, in their program, at the most local level, understanding what the goal is, what the targets are, and taking those critical things that really cannot be compromised and then adapting all around that, all around these fundamentals. Is this what's your response from where you sit and the decisions you make as a senior manager with respect to your staff? How do you agree or disagree with the statement? What are your thoughts?
I agree with the statement. When you are down there, you know the people, you know your targets, you know the coverages you are having, what's administrative and what is happening on the ground. So mostly you are better informed. You are better to take decisions to solve the local issues. If we miss out on these routine immunization, we'll start having outbreaks of measles, yellow fever, and others, which will cost us more. So we are looking at the data, what we are doing, and making sure we reach out. So I agree that those at the local, looking at your data, you could be able to make more informed decisions on what is really urgent that we need to tackle.
Thank you, Dr. Akosia Gima Omari Sasu. Let's listen to Dr. Godwin Mindra. He works at the global level. This is his message to immunization staff. Let's have a listen.
We do at HQ would make no sense if at the country level it's not translated into practical interventions. That's why we come back to you at the country level, at the district level. Those of you who have direct contacts with communities, you matter. You are the ones who translate most of the work that we do at the HQ and regional level into practical interventions that addresses the needs of children who are not able to receive vaccines. Without you, we will not do it. And we are very appreciative that you're taking time from your regular duties to even get more focus into what is it that we can do to address immunization coverage. We know that it has stagnated. There are a critical mass of children out there who are not reached. Globally, we're thinking about 20 million kids who are not reached. In countries, it could be different. If you look at the country level, at the national level, you have a figure, but we need to go down into the districts. And it's you who are sitting in the districts who have the opportunity to identify these children, who have the opportunity to develop context-specific strategies to reach these children with services, because you are the ones who know where they are. You know where their needs are, you know what they want, and you know how to deliver this. You have done this, and I'm sure you will do this.
Dr. Godwin Mindra, who works at the global level, and we are calling, of course, for the for immunization staff everywhere to join the movement for Immunization Agenda 2030. You're joining us. If you're just joining us, we are discussing what we learned from Teach to Reach Connect 4, which is a unique quarterly networking event where you can come in, press a button, and you're connected with a fellow immunization professional and can share your experience. We propose themes, but you're free to just meet, network, and learn. And we're actually reviewing now what we learned from Teach to Reach 4. Over 6,000 immunization professionals registered for that one. And Charlotte and Boo from our Insights unit collected over 1,600, analyzed over 1,600 pieces of feedback from participants. We had a networking session on a topic that is quite important, and that is the COVID-19 vaccination of health professionals themselves. So immunization professionals obviously have focused on protecting children from vaccine-preventable diseases. That has changed in the last few years. And of course, COVID-19 vaccine was initially offered to first to adults, even if it's been extended now to other segments of the population. So Charlotte has selected this quote. Let's hear it from Charlotte herself. This is someone who works in a health facility, says probably a student, and working in Nigeria.
Yeah, I said it was fascinating to hear different people share their experiences. Particularly of note was a health worker that had to go and get vaccinated after being questioned by someone. It showed that we as healthcare workers have a huge role to play in preventing vaccine hesitancy in our community by acting as role models. We have to practice what we are preaching to encourage others to do the same. Thank you, Rena.
Thank you, Charlotte. And this became a recurring theme. People who said that they went in to vaccinate against COVID-19 in the community. And this is what they were asked. Are you vaccinated? How do I know that you've taken this vaccine? There are many, many testimonials really highlighting that role of health professionals as trusted advisors to communities. But that trust needs to be earned and maintained and strengthened. So we have this second quote. So this is actually from someone who works in a district in Ghana. So again, we anonymize these. It'd be lovely to put a name, a photo, to know the name of the district. But of course, we have to find the right balance between protecting the confidentiality of individuals who participate in Teach to Reach and sharing enough information. So Charlotte, over to you. What is this one about?
Yeah, similar to the first one, Red, I say the most interesting thing to me has to do with health workers' engagement in COVID-19 vaccination. I think a leader shows the way. A leader is an achiever, and as health workers, we must show the example for the people to follow. So if we really want people to actually take the vaccine, the health workers have to take it first.
Indeed. Let's see. Let's see if Ali, who's just joined us, who's been able to join us in the Zoom studio. Ali, are you able to speak to us? I'm asking you to unmute. It would be lovely to hear your thoughts on this as we discuss what was the theme of the third networking session, and that is to discuss the vaccination, the COVID-19 vaccination of health professionals themselves. All right, Ali is in the studio with us, but he's not answering. So let's go now to the next. And I believe this is a final segment from the last plenary session, really looking at lessons learned. So here is one again from Ghana. I'm glad to see that with a director of the Ghana Health Service in the room, we have many testimonials that were picked by our Insights unit that are from the Ghana. This one is also Subnational Ministry of Health staff. It says, I got very motivated to carry my immunization project beyond the current status quo. I really got a deeper understanding of universal healthcare and appreciate the role of my project in meeting targets. All right, the next one is from Uganda, again from the district, and we're discussing the insights gained from Teach to Reach Connect 4, which happened on the 10th of December last year, as we're counting down to Friday, 4th of March, which is when we'll be having Teach to Reach Connect 5. And again, building this time towards the launch of the Movement for Immunization Agenda 2030. Charlotte, let's hear this testimonial from Uganda.
I learned that I can integrate other primary healthcare activities with the COVID-19 activities effectively without paralyzing others. I had fears that will not be possible to achieve. It will not be possible to achieve the immunization agenda. But on the consultative sessions I realized it's possible since my fears were driven away when my questions were answered rightly. Therefore, to that effect, at my workplace, I am very motivated and committed to intensifying strategies towards vaccine uptake by strengthening mobilization and sensitization on COVID-19 activities and by using the behavioral change communication strategies. Thank you, Reda. Over.
All right. Thanks, Charlotte. So these are examples, just a few from over 1,600 people who took time to share their experience, and we've selected a few. We would love to put names and photos to them, but we can't for obvious reasons. We have a few more to go, and then we're going to share with you, and this is truly an exclusive. For the first time, we're going to be sharing a few of the data points from the incoming applications for Immunization Agenda 2030. So this one is, all right, another Ghanaian. The analysis of peer-reviewed work generated by frontline health workers at subnational level was insightful to me. The idea that such rich information could be gathered from everyday individuals, not academics, was quite revealing. It points to how much information we can get by simply interacting with frontline staff at all levels of the health system. And indeed, in the so this is referring to the an exercise run by the Geneva Learning Foundation, but really run by over 700 health professionals from over 50 countries, I believe, who developed case studies sharing their unique insights into how they had actually successfully overcome vaccine hesitancy, challenge a group or individual, and change their minds and perhaps save their lives by helping them be protected from vaccine-preventable diseases. This is the spirit of the movement for Immunization Agenda 2030. We've lost years of hard work due to the pandemic. Hopefully that is going to be recovered soon, but the challenges are still there. And so we encourage you to apply, to join, to benefit from this kind of peer learning, peer-reviewed work generated by frontline health workers. That's you. And the application deadline, you can see, is this Friday. So do not delay. In terms of what we're actually going to do, here are some of the activities. So we'll be starting, of course, with Teach to Reach Connect on Friday. But then the one you don't want to miss is the movement launch event, which will be on Monday, 7th of March. Let me scroll back down to the schedule here. Now, we'll be kicking off with the Ideas Engine, where you'll be choosing your most difficult, important challenge, and then you'll be sharing the practices that you've found that are helping you keep immunization going, and you'll be able to connect with and learn from the ideas of colleagues from all over the world. So that will be the first weeks from 7th of March until the 18th of March. That'll be followed by Situation Analysis starting on the 21st of March. And this will be analyzing your situation before you take action. Let me refer you back to this quote: "Action without thought is empty. Thought without action is blind." And so in order to avoid blindness, we'll be working together to develop situational analysis. And this is open to everyone, whether you work in a health facility, whether you are a district manager, whether you work at the regional level, in a state, or at the national level. You can analyze your situation and benefit in order to better plan your actions. We'll, of course, be celebrating World Immunization Week, and then we'll be going into a massive hackathon with thousands of health professionals joining to problem solve their challenges together and map out the actions that each of us needs to take to make progress. That will be followed by what we call the Impact Accelerator. We'll have lots of opportunities to come back and share the actual schedule. But what I'm actually eager to share is to show you this, and I'll be very quick. There'll be more. We'll be sharing more exhaustively on Friday at Teach to Reach. We'll have a special session, and then on Monday we'll be sharing the final results for the first cohort of the IA2030 movement. So you can see that we've received 2,653 applications from health professionals to join the movement for IA2030. So let me show you who is in the movement currently. So you can see, and this is the first time it's happened, more than 30%, almost a third of the participants are from health facilities. So the access challenges, the other barriers, the level of literacy and the level of digital literacy that got in the way in the past, we've never seen this many people join from the facility level. And that means those are the individuals. If you work in a health facility, you are the one who is in contact with caregivers, with children every day, with COVID-19 vaccination, with adults as well. So it is very important. And this is the vision expressed in Immunization Agenda 2030, the strategy defined and agreed upon by all of the world's countries, including your own. So that very important to see this. 24% from the district level, 19% from the national level. We know that the role that the central level has, the Ministry of Health in the capital city, is key. They're responsible for the planning. They are the interlocutors for the international agencies that support immunization, that support the country. It is absolutely important, indispensable that they be in this movement. And in fact, one strength of this approach is to have everyone together across system levels supporting each other while the existing chain of command remains, but in this case, providing a unique opportunity for people to dialogue and to share. Now, I do want to offer a round of applause to the top countries that are leading the recruitment for Immunization Agenda 2030, so for the movement and for what we're calling the full learning cycle. So you can see here, at the top is Nigeria with almost 1,000. Now, if you are a Nigerian listening to this, if you can find 4 of your colleagues to apply for the movement, that will put you past, that will put you at the 1,000 mark in terms of the number of people who have applied. Second place is Ghana with over 302 respondents who have applied to join and been accepted to join the movement. Third is Pakistan, followed by India. So 136 and 119 respectively. Now, this is not a competition, but there is a healthy element by which we can share with each other and support each other as we work towards to the movement. Now, again, to take you back to where this starts, let me see if I can find. Yes, it's here. All right. So this is the Movement for Immunization Agenda 2030. We've been sharing what we learned from Teach to Reach, and I want to show you a little bit more beyond the countries and the health system levels. I want to give you a bit of a taste of what we are learning through your sharing. This is something that we owe you. You are trusting us to share a lot of information about your situation. So for example, here you can see we have doctors, community health workers, public health specialists, nurses, midwives, pharmacists, all kinds of categories of individuals. We have people in the movement that are going to be starting the full learning cycle on the 7th of March with a lot of significant experience. We also have younger people coming from other areas of public health or of medicine that are joining as well. So very, very heartening. We have many people involved in the National Immunization Strategy. And this is the Movement for Immunization Agenda 2030. It needs to have the diversity, needs to have the strengths of each of us, each of you. So if you haven't spoken yet to your colleagues, please do so as soon as you can. We know many of you, you can see here, almost two-thirds are directly involved in COVID-19 vaccination. And to give you just one example, there's a lot more we'll be sharing on Friday at Teach to Reach, and then on Monday for the launch event. It's really split almost three ways. Now, a little bit more people think that COVID-19 vaccination has actually hurt routine immunization services. 30%. I guess had no effect, hasn't changed anything. And then almost 30% think that it's actually helped routine immunization services. So what's really interesting is the qualitative feedback that applicants to the Movement for Immunization Agenda 2030 have been giving us, sharing about what is the situation where they are. What do they see in terms of how COVID-19 vaccination has affected the work of routine immunization that is so critical to maintaining the coverage levels, or actually regaining the coverage levels, and hopefully exceeding them as we progress towards Immunization Agenda 2030. So I think that is all we're going to share. There is so much more information that we're learning. We look forward to sharing far more on Friday at Teach to Reach. So let me just allow me to recap. But before I do, let me see if Mukwele Cynthia, you've joined our Zoom studio. Are you able to speak to us? We'd love to hear from you. Mukwele? All right, and let's see if Shahidullah. I'm also asking you to unmute. All right, so let's see. Oh, yes, Mukwele, are you able to speak to us?
Yes, good evening. I'm glad to meet you all.
All right, good evening to you, Mukwele. Please tell us, where are you connecting from? What's on your mind as you've been listening to this, what is happening, what we're learning from Immunization Agenda 2030. But please first introduce yourself.
Okay, Mukwele Cynthia Bemo, coming all the way, connecting from Cameroon. I'm sorry for being late, but I joined this wonderful group because I'm actually working on immunization as the communication focal point person at the Delegation of Public Health, precisely in Boya.
All right. Well, welcome to you. And I'm guessing that if you are, you called it late, but it's because you were busy with your daily duties, and we very much want you to focus on those first and join us when you can. So thank you for being with us. I don't know how much you were able to hear, but what are first of all, are you joining the Movement for Immunization Agenda 2030?
Yes, I'm joining the movement.
Have you received your letter of acceptance?
Yes, received already.
All right. So first of all, let's offer you a round of applause because you are one of thousands. Mukwele Cynthia from Cameroon. And is this the first time that you're joining an initiative like this one?
It's my first time.
All right. So I think we need a second round of applause. I remember Charlotte was also from Cameroon when the first time she joined. Were you apprehensive, Charlotte? What were your fears when you first connected and heard all these people from all over the world sharing experience, working on the course? What would you like to say to Mukwele, Cynthia?
Well, to me, it was more of excitement and hope than fear, rather. My greatest apprehension, and it's the same apprehension till date, was connectivity. But apart from that, just the fact that I was going to be benefiting from the collective intelligence of people from several countries, more experience in immunization than myself, was to me like, okay, this is a grapevine, this is a gold mine. I just wanted to dig in and get the best out of it. And what is amazing is that up till this moment, I am still I think we are just scratching the surface, because with each event, with each course, reading the feedback from peers, reading the comments, going through reviewing all the reports that they submit, we still digging. We just get so much information each time, and so I can just tell Cynthia that you are in the right place. I could just say welcome home, and we say scholar. That is, once you're a scholar for life. So I just hope you're going to make it through the full learning cycle, and that listening to the experiences of others, you're going to gain so much information that will transform the way you look at immunization and the way you offer immunization services in Boya, where you are, and in the Southwest region, of course. Thank you, Reda.
Thanks, Charlotte.
Thank you very much.
And Mukwele, let me ask you this. As you know, when you applied, you were asked, what is your biggest, most difficult challenge? What was your answer? What kind of challenge are you facing?
The first challenge I have was to communicate in public and how to interpret and report data gotten from the field, and how to manage hesitance cases.
Okay. All right. Thank you. So I hope that you will get to learn many from your colleagues from all over the world will be able to share the progress they've been able to make. Thank you so much, Mukwele. Cynthia, I believe for your first time in a scholar event, in the event for the Movement for Immunization Agenda 2030. Let's have another round of applause. We have, so let's see, we have... sorry, I did not acknowledge this earlier. Hawa Buhari, who says, in response to Dr. Godwin Mindra's statement, we're committed to delivering our duties. So Godwin made the point about those of you who are in touch with caregivers with children. That is where the front line is. That is where vaccination happens or does not happen. All right, good to see Amel El Tahir connecting from from Saudi Arabia, and then Atahir Abubakar, who says Nahenza's greetings from Nigeria. Good to see you always. Now let me recap what we've got, especially if you're new, especially if you are just joining us for the first time. Let me see what's happening here. So first of all, one really good solution if you are if you have poor connectivity. Let's be honest, many people do. You can go to learning.foundation/podcast, and what you'll get is easy access to the audio only. So this is like listening to radio. For example, here, if I go to Google Podcasts, you can use any podcast player, but Google is the one, especially if you have an Android device, that's easiest to use. You can see all of the available episodes. So lots to, for example, here is guidance. If you're struggling to complete your application to join the movement, here is actually the message from Godwin about why immunization staff in countries matter. Here, there are different things you can listen to. So it's a great way to follow along without spending all your bundles, because video is very expensive for many of you. Second thing I'd like to share is, of course, Teach to Reach 5. So we're counting down. You can see there's 3 days, 20 hours, and 33 minutes remaining. Just to highlight this is amazing. This page has been shared 5,700 times. How do you share? Well, if you have colleagues you don't want to go alone, make sure you go with colleagues. It'll be much more interesting, much more productive, much more fun as well. Just click on that WhatsApp button. And here, you click allow, and that opens up the WhatsApp application. I'm not going to do it now, but that's just to show you how easy it is. And then we have the International Women's Day event. So women who deliver vaccines. Let me get myself out of the way here. This is a special event intended for women and men to come share their solidarity, to listen, learn from, and honor women who are working alongside men to maintain immunization services, to learn from and support each other. We work in health facilities, districts, regions, in the national team. We're nurses, doctors, community health workers. Some of us are senior decision makers. Others do the daily work of vaccination. That makes the difference between children, families, and communities being protected from disease or not. Wherever we work, whatever our rank and status, we're women who deliver vaccines. That is a statement. And you can find some testimonials here. And of course, last year's event, and meet some of the amazing women who are organizing this special event. That's our very own Satabdi Mitra, doctor from West Bengal, India. And then you can see the names of the women who came together to create this, the collective that's organizing this event. So then, if you haven't joined yet the Movement for Immunization Agenda 2030, want to encourage you to do so as soon as you can. So here is, you can see here why we're calling for the movement. You can see the opportunity. Again, the same system. There's always put in your name, put in your email, and then check your inbox. Make sure it doesn't go into spam. Once you've completed the application, assuming your application is in good order, you will receive your letter of acceptance confirming that you've been accepted into the movement. What exactly are we going to do? Well, read on. You can see the 3 top reasons here, and then the actual calendar of activities. Now, it is an opportunity to really focus. This is not about attending webinars or anything else that can really take you away from your work. It's the opposite. This is actually about helping you with the work that you've been tasked with what your boss wants you to do, what your Ministry of Health is asking you to do, what your country is asking you to do, and just giving you access to talent, information, knowledge, expertise, colleagues from all over the world who are facing some of the same challenges as you, or maybe they're different, but you can all learn from each other. So it is not about taking up your time with something that does not help you. And there is, of course, an opportunity to earn certificates from the Geneva Learning Foundation for each step. In fact, there are, for the very first time, 3 levels of certification that you'll be able to secure by participating in the successive activities. Now, be careful because there are stringent certification requirements. You can see, so they're not spelled out here, but we'll be spelling them out on Monday when we meet for the first of a weekly assembly where we'll be really sharing experience and keeping the movement going. That Monday assembly is probably the most important time when you should attend. If you're confused or need help, you can always find, there's already a set of videos explaining to you how to apply, what the movement is about, and so on and so forth. So take the time to read through the page. In some cases, there are no shortcuts, I would say. And I think that's it for today. Thank you, Emanuela. I wish we could have heard from you. Let me try one more time. Maybe you weren't able to speak to us. Would love to hear your voice. Emanuela Chinonye, are you able to speak? No. All right. You may be. All right. So let's end here, Charlotte. Let's end with a round of applause. Still, actually, more people on the live stream in Telegram than before. All right. So let's just want to congratulate each and every one of you. We're doing this with you. We're doing this. This wouldn't make sense without your participation, your commitment. We're just trying to support the work, the critical work that you are doing to keep immunization going. Wishing you well, and take care. We'll just rewind some of the comments now. Haven't had time to do this in a while, so thank you. Emanuela, are you there? Are you able to speak?
Yes, Reda, I'm here, but I'm not able to speak at this moment.
I understand. I'm just glad you were able to join us. Thank you. And
yes, thank you very much.
all right, take care.
All right.
And for those of you who followed on Telegram, let me know how it went, if it was a good experience or not. We're still experimenting with live streaming there. Take care. Bye-bye.